Good evening, students. So, I am. Good evening, students. I am from Easy Nurse, where nursing is made easy. So, today let's discuss about MSN. I'm going to give you an introduction to MSN. So, let's begin. So, these are the topics that we are going to deal with. Definition and scope of MSN, definition of health and illness, concept of health, health illness continuum, nursing process, roles and responsibilities of nurse, ethical and legal aspects of nurse. So let's deal with all these topics one by one. So first let's learn about the definition of MSN. Medical surgical nursing is a specialized branch of nursing that involves the nursing care of adult patients whose disease condition are treated medically, surgically, and pharmacologically. That means MSN is a specialized branch of nursing, which means we will be dealing with the patients, especially in care of adult patients, that can be medically, surgically, and also pharmacologically. And it involves prevention, treatment, and rehabilitation of patients. Next, it's scope of MSN. Medical surgical nursing is practiced in a variety of settings across the continuum of care. These settings include but are not limited. It means while we are after learning this MSN, we will be having several areas to work. Those areas can be like hospitals, like wards, OT, ICU, and even other specialized branches also you can work. Then we will be doing a work in clinics, then community health centers, home care, schools, insurance, and private companies also. And even there are extra other opportunities also that we can do the work. Next is the definition of health and illness. Health plays a major role in MSN, especially a patient's care, health, everything is depending on this health. Health is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. It means a patient's or a person's physical, mental, and social well-being will be calculated in the health. Only then we can say a person is physically fit. Next is illness. Illness is a condition characterized by a deviation from a normal health state, which is manifested by physical and psychological symptoms. Yes, illness can be taken by a person's physical and psychological symptoms. During a person's physical health, whether he is affected with any kind of disease or problems, and also even psychologically, if the patient is affected with any minor stress or discomfort, also will be calculated as illness. So the next is concept of health. Concept of health means it is divided into four types. Four types is, first one is biological concept, second is ecological concept, third is psychological concept, and fourth is holistic concept. We will be learning each concept in one by one. The first one is biological concept. Health is defined as the normal functioning of the body and absence of disease. Biological concept means a person's physical body is being calculated. It means a person who is having any fever, pain, or infection cannot be considered healthy. When the person is not having all these problems, they will be considered as healthy. Next is ecological concept. Ecological concept means health is the result of balance between human beings and their environment. Means in ecological concept, we will be dealing with the environment. If the environment or the surrounding is good, then the person will not be having any disease. If the environment is being polluted, then the person will be having respiratory diseases, and also they will not be having a good health also. So we need a clean environment. Only then we will be having a good health. Next concept is psychological concept. In psychological concept, health is related to mental and emotional well-being. Mental and emotional well-being. This is the main point. It means, example, a person who is calm and stress-free is mentally healthy. It is very simple to understand, because a person who is very fit, then the person is in the psychological concept. Next is holistic concept. Holistic concept means it is dealing with physical, mental, social and emotional and spiritual well-being. Only with this the person will be healthy, and so they will be in the holistic concept. For example, physically fit, mentally stable, social active, emotionally balanced. This is on the holistic concept. Next is health illness continuum. Health illness continuum plays a major role in a person's body. Means it is a concept that shows the health and illness are not separate but exist on a continuous scale. On a continuous scale, there is a health illness continuum scale also. We can discuss about that. In this picture, it is depicted very clearly. This is the person who is very much healthy, and this is the person who is in a normal health, and the next one is the person who is in the mid level of healthy. It means the person might be having a small sick, fever or cold, like that. And the next one is, if the person is not at all treated, then the person will be in the severe disease and can occur death. That is this. So we can learn about one by one. Okay. First is high level illness. If the person is having high level illness, that means the person will be in a very good health. Okay, peak health condition. Next, it will be physically fit, mentally stable, socially active and healthy lifestyle. The person will be physically fit and he will be having good diet, good exercise, everything. That is called a person who is in a healthy well-being. Next one is normal health. In normal health, the person will be having no major illness but will be having a normal daily functioning lifestyle and may have any minor stress or discomfort. And the next is mild illness. In mild illness, the person will be having an early stage of disease and will be having symptoms like fever, cold, weakness, and they need only a less amount of care. That is mid-level illness. And the next is severe illness. Severe illness means the person might be having a disease which is very in a severe condition, and so that person will be needed any requires very immediate treatment and hospitalization, and also needs medical attention also. And if this treatment or if this disease is not treated properly, then the person might be going to the death stage, and that is end of continuum and occurs if illness is severe or untreated. So we have to treat the patient before before in the mid illness only, then the person will not be going to the death. This is the health illness continuum. So we can check the scale. This is health wellness continuum scale. So you can see this is health level wellness, and you can see from if the person is above 10, then they will be in the optimal health, and if they are from 7 to 9, then they will be in a good health. Next one is 4 to 6, that will be neutral health, and the next is 1 to 3 will be in poor health, and the next is 0, where the person will be having disease and also the person will be in death stage. That is called health illness wellness continuum scale. Okay, next is nursing process. We can go about a small introduction of nursing process, because there will be another nursing process chapter to learn in a vast area. Okay, so nursing process definition is: nursing process is a systematic, organized and scientific method used by nurses to plan and provide patient care efficiently. It means where in nursing process, the nurses will be organizing in each steps. There are 5 steps that we will be going and learning one by one, and those with the help of those 5 steps, we can give patient care effectively. So this is the nursing process. You can see the first one is assessment, second one is diagnosis, third one is planning, fourth one is implementation, and fifth one is evaluation. So we can go one by one. First, let's learn about assessment. This is assessment. Assessment is the first and most important step of nursing process, where the nurse collects, verifies, organizes patient data. When a patient is coming to the hospital, the nurse will be taking the data, that is the demographic data, and also the past history, present history, each and every history we will be taking about the patient, and we will be assessing the patient. And while assessing the patient, we will be having two types of assessment. It is, one is subjective data and other one is objective data. Subjective data means information given by the patient. So it will be based on the feelings or experiences. Like the patient will be saying that I am having pain, I am tired, and etc. etc. What are the problems are given by the patient by themselves is called as the subjective data. And the next one is objective data. Objective data means information about the nurse that is measurable and visible. It means we will be taking the we will be assessing the patient, and by assessing the patient, like if you are checking the BP or temperature, whatever, you will be getting a value by what the patient is affected. Like if the patient is having fever, while checking the temperature, you will be knowing whether a patient is having a high amount of fever or he is in the normal level of fever. Like that, even if you're checking BP also, we can understand whether he is in hypertension or hypotension. So this is called the objective data. By this assessment, we can easily know about the patient's health condition. And the next process is diagnosis. Diagnosis is the second step in the nursing process, where the nurse analyzes assessment data and identifies the patient's health problems that nurses can manage. That means after knowing the assessment, the next step is diagnosis. So we will be making a diagnosis for the patient, and the diagnosis include these steps. These 5 steps: analyze assessment data. First, we have to analyze the assessment data, like subjective data and objective data we will be analyzing. And the next one is identify abnormal findings. We will be identifying each and every abnormal findings, like what all the abnormalities the patient is having. That is the second step we will be assessing. And the third one is group related data. We will be grouping each and every data according to the problems. And the next one is identify problems. After identifying the problems, the last one is write diagnosis statement. We will be writing a diagnosis statement. What treatment is needed to be given, and how we can how we can give the treatment, or how we can diagnose the patient. Next step is planning. In this stage, develops a care plan to solve the patient's problems identified in the nursing diagnosis. After doing this diagnosis, the next step is planning. In this stage, we will be planning what all the treatments, what all the things has to be given to the patient. So first, the nurse will be taking the priorities, setting the priorities. It can be, if the patient is having fluid loss, we have to give fluid first. So like that, we will be setting the priorities according to the patient's condition. And the next is setting goals and outcomes. We will be setting a goal and outcome, like we have to give fluid to the patient, and so after the fluid given, what all the outcomes will be coming, all those things we will be planning. Or just we are planning in this stage. And next one is nursing intervention. Same, we are planning in that. And the last one is documentation. We have to document each and every planning methods. And the next stage is, the next process is implementation. Nurse puts the care plan into action to achieve the patient goals. So we have to attain the goals in this stage, because we are going to implement the planning. What all the planning we have taken, we will be implementing in this process. So the steps in implementation is reassessment of patient. Once again, we will be reassessing the patient's documents and things. And next is review care plan. What the nursing diagnosis we have already prepared, then we will be just reviewing what are the care plan we need to be given after the reassessment of the patient. And the third one is perform nursing intervention. So now we will be giving what have we planned for the patient, like giving fluid or giving oxygen administration or patient care, what we have to give, that we will be implementing. That is the nursing intervention. And at last, we will be doing a documentation. In each stage, we have to document everything, like what are the things we have been taken. So finally, we have done the documentation. And the fifth one is evaluation. In evaluation, it is a final step of nursing process where the nurse assesses whether the patient goals and outcomes have been achieved. In this process, we will be checking whether the patient is having all the whether all the outcomes has been received or the patient goals is being achieved. So in this, again, we will be collecting data. What all the planning we have given, what all the things we have implemented, and how the patient has responded. And then compare with goals. What are the goals or plannings we have already created? We will be comparing whether the patient has got any different or he is responding to the treatment that we will be doing. And next is judge outcome. After giving the planning and after implementing that planning, what outcome has the patient given or patient's body has responded to the medication or the care we have given. And the last one is modify care plan. In this stage, sometimes the patient will be the patient will be getting the patient will be having all the problems will be solved by giving this nursing process or this treatment. He will be getting okay. If not, then we have to do another process or planning, or then we can ask the patient to follow up or just stop the care. So finally we have completed the nursing process. This is very simple, and we have only 5 things, the like assessment, diagnosis, planning, implementation, and last evaluation. Next is roles and responsibilities of nurse. In roles and responsibility of nurse, the main responsibility for a nurse is, first one is patient care. She or he must do patient care. They have to give the care to the patient. Next is coordination with healthcare team. It is very important because we need a very good communication with the team members and very good coordination. Only then we can give or attain a goal of giving a good patient care to the patient. Next is ensuring safety and recovery. Last stage, whatever treatment we have given, we have to check for the safety of the patient, and we have to check whether the patient is recovering from the problems. Everything we have to check. By then we can do the recovery. And the next one is roles of nurse. In roles of nurse, first one is caregiver. Caregiver means a nurse is a patient or nurse is a person who is needed to give care to the patient. She should be a caregiver, like bathing, feeding, everything will be taken care of a nurse. And the next one is advocate. She should advocate or do counseling to the patient regarding her rights, regarding the patient rights, what are the medications they need to be taken or how they want to be given. Everything will be ensuring. After educating, we have to educate the family members and also the patient regarding the medication or regarding the hospital things. And the next is coordinator. He or she should be a coordinating person in the place where we have to give the treatment. And next is counselor. They can be given emotional, spiritual, and also they should give the counseling to the patient about the treatment, and then we have to console the patient regarding all the process. And the researcher, we can research whether there is a new medication, or we can give them whether they need to be set into a new place. Everything we can be checked. And the last one is the leadership. A person, especially in nursing, the nurse has all these roles. So all these roles are based on this nursing process, and also in the field of nursing. Next is responsibilities of nurse. The first one, as we told, it's patient care. We have to provide patient care to the patient. And next is documentation. We have to document each and everything, whatever we do with the patient's history or patient's treatment. Everything we have to record and report. And the next one is safety responsibilities. We have to take care of the safety for the patient, whether we are giving good hygienic, we have to provide a good hygiene environment. We have to do the aseptic techniques and infection control. Everything we have to be maintained. And the next one is medication administration. Medication administration is of 5 types. That is right patient, right drug, right dose, right time, and right route. All these things have to be checked before giving medication to the patient. And the next one is communication. Communication is the main thing in the nursing, especially with the doctors, therapists, and also with the patient and family members. We have to be in a good we have to do a good communication with all the members. And the next is observation and reporting. We have to observe the patient while giving treatment and also after the treatment, whether the patient is okay with the treatment or he is responding in a good manner, and then we have to report in and document in a paper. Ethical and legal responsibilities. In ethical and legal responsibilities, we should not do any negligence. We should be careful about giving the treatment. Whatever procedure you do, we have to give create awareness to the patient, and then we have to take the consent of the patient before everything, and by then we can do the ethical and legal responsibilities also. So these are the responsibilities of nurse, how we can give care to the patient. And now we are going to conclude. Like, medical surgical nursing helps nurses deliver holistic, patient-centered and evidence-based care, promoting recovery, preventing complications and improving the overall health and well-being of patient. So giving introduction to medical surgical nursing, I would say that we have learned this health illness continuum, definition of health, then a definition of MSN, then also we have learned the nursing process also. All these things are included in this introduction, and by then we can learn each and everything by in a separate chapter itself, especially the nursing process. So by then I conclude. So I hope you like my class, and we are having an Easy Nurse app. It is available in the Play Store, where for post basic MSc, then BSc, and also for GNM we are providing classes. We will be having live classes. We will be having we'll be having live classes, then PDF notes, then we will be helping you for your studies. So if you are okay, then you can join our class. We will be having 1,500 off also nowadays, so you can join our course. So thank you.